Hello all, welcome to TCAM Tutor YouTube channel. So we'll see the next part of question paper session. So the next question was tropical pulmonary eosinophilia is usually caused by, that was the question. So the tropical pulmonary eosinophilia means it is a condition which is happening in the case of lymphatic filariasis. Okay, those who are suffering with the lymphatic filariasis, in that condition you can see tropical pulmonary eosinophilia. Okay, it is characterized by main three symptoms, that is called wheezing, fever, eosinophilia. Okay, so eosinophilia is entering into the lungs and that condition is called as tropical pulmonary eosinophilia. So it is associated with the lymphatic filariasis. So the lymphatic filariasis is caused by Wuchereria bancrofti, Bruggeia malayi and Bruggeia timori. These are the causative organisms which is causing lymphatic filariasis. So those who are suffering with the lymphatic filariasis, there will be, when this parasite is entering into the human body, sometimes there will be hypersensitive immunological reaction will be happening against this parasite in our body. Hypersensitive immunological reaction is happening, and as a part of that there will be excessive eosinophil count will be increasing inside the lungs, and because of that the patient will be suffering with severe cough, bronchospasm, wheezing, abdominal pain, enlarged spleen will be there. Okay, because of the excessive eosinophil count is increasing inside the lung as a part of the hypersensitive immunological reaction. So the patient will be suffering with the cough, bronchospasm, wheezing, abdominal pain, enlarged spleen will be there. An important symptom is they will be getting cough that will always aggravated at the night time. Okay, there will be recurrent cough will be there, so that will be aggravated during the night time. Okay, so these are the main symptoms of the tropical pulmonary eosinophilia. Another one term is there, tropical pulmonary eosinophilia, that is also known as Weingarten's syndrome. Weingartens, Weingarten's syndrome. Okay, so tropical pulmonary eosinophilia, otherwise known as Weingarten syndrome. So here the question was, tropical pulmonary eosinophilia is usually caused by which organism they have asked. So it is associated with the lymphatic filariasis. So lymphatic filariasis is caused by Wuchereria bancrofti. Okay, so the answer is Wuchereria bancrofti for this question. So other organisms, Ascaris, Ankylostoma, Strongyloid stercoralis. So these three organisms, they are causing eosinophilic pneumonia. Okay, so tropical pulmonary eosinophilia is caused by Wuchereria bancrofti, Ascaris, Ankylostoma, Strongyloid stercoralis. These three organisms are causing eosinophilic pneumonia. Next question, pelvic pain we can see in common in which all the conditions. So options, fibroid, endometriosis, ovarian cyst. If all of the above option is there, then you have to choose all of the above. Okay, otherwise if these three options are given, then you can choose endometriosis. Okay, so pelvic pain commonly you can see in the ectopic pregnancy, you can see endometriosis, adenomyosis, ovarian cancer or ovarian cyst, pelvic inflammatory disease, uterine fibroid. In all these cases you can see pelvic pain, that is the main symptom. So these are the conditions where you can see the pelvic pain. So option is all of the above, you have to choose it. If all of the above is not there, then you can choose endometriosis. Okay, so there you can see the first symptom is severe pelvic pain will be there during the menstrual cycle. Next question was recurrent pain, abdominal pain, diarrhea, fatigue, normocytic anemia and anti-endomysial antibodies are present. So what is the diagnosis they have asked? So anti-endomysial antibody you can see in the case of celiac disease. Okay, celiac disease means it is a autoimmune condition. So this autoimmune condition is generating whenever the patient is taking gluten content diet. Okay, so whenever the patient is taking gluten content diet, what happen? There is an inflammatory changes is happening in the small intestine. So as a part of that inflammation, our body will be producing some antibodies. So that antibodies are anti-endomysial antibody, anti-tissue transglutaminase, anti-gliadin. So these are the three antibodies are produced by our body during the celiac disease. So anti-endomysial antibody, it is a main antibody, it is produced during the celiac disease. Okay, so celiac disease or celiac sprue, it's mean it is a autoimmune disorder against the gluten content diet. Okay, so the confirmatory investigation for identifying celiac disease is the small intestine biopsy. So in that small intestine biopsy, you can see villus atrophy. Okay, because of the inflammation, villi has become degenerated, and because of that, what happened? Malabsorption. The proper nutrients will not be producing, fat absorption. Okay, so digestion process, all these things will not be taken. So it result in the diarrhea, foul smelling diarrhea, steatorrhea. Steatorrhea means fat present in the stool. Okay, because villi has got atrophy, so because of that, what happened? Fat digestion will not be there, so fat will be present in the stool, steatorrhea. And villi has got inflammation, so there will be proper absorption of the nutrients will not be there, so you will be getting nutritional deficiency, especially vitamin B12 deficiency you can see, because small intestine is the area where the vitamin B12 is absorbing, so the vitamin B12 deficiency you can see. Then failure to thrive, weight loss, because proper absorption of the nutrients is not there, so it results in the weight loss, failure to thrive. Okay, and you can see increased number of T lymphocytes will be there. Okay, so this type of things you can see in the case of celiac disease during the biopsy. Okay, so the main thing is gluten content diet whenever they are taking, so that time autoimmune activity will be generating, so because of that there will be inflammation is happening in the small intestine villi, so that condition is called celiac disease. So the clinical feature is diarrhea, steatorrhea, nutritional deficiency, and small intestine biopsy is the confirmatory investigation. And if you do the antibody test, so you will be getting anti-endomysial antibody, anti-tissue transglutaminase, anti-gliadin. This type of antibodies will be present, so that is indicating patient is suffering with the celiac disease. Okay, so diet restriction means they should avoid the gluten content diet. Which are the gluten content diet? That is barley, rye, wheat. Okay, so this type of food items whenever they are taking, so that time they will be getting this celiac disease. So this type of food they have to restrict. Okay, so here the option was celiac disease is the correct answer. Okay, because anti-endomysial antibody that always indicating celiac disease. Okay, ulcerative colitis, Crohn's disease, that is also comes under the IBD category, inflammatory bowel disease. Okay, that is both ulcerative colitis, Crohn's disease, both are inflammatory condition. So to confirming ulcerative colitis, Crohn's disease, you have to check fecal calprotectin. That is the marker for identifying the IBD. Fecal calprotectin. Okay, for identifying celiac disease, anti-endomysial antibody, anti-tissue transglutaminase, anti-gliadin. For identifying the ulcerative colitis or Crohn's disease, the marker is fecal calprotectin. Okay, fecal, F-A-E-C-A-L, fecal calprotectin. Okay, so that is an inflammatory. Whenever there is an inflammation is happening in the intestine, this fecal calprotectin will be there in the stool. Next question was, a patient has ecchymosis and petechiae all over the body with no hepatosplenomegaly. All are true except which one is not true. That is the option. Okay, ecchymosis petechiae means you are getting bleeding in the skin. Okay, there is a bleeding is happening, but there is no hepatomegaly and splenomegaly. Then what was the condition? That is actually idiopathic thrombocytopenic purpura. Okay, this condition is indicating idiopathic thrombocytopenic purpura or immunothrombocytopenic purpura. Okay, immunothrombocytopenic purpura or idiopathic thrombocytopenic purpura. Okay, here what is happening means there will be reduced platelet count is happening in this condition. Okay, in ITP there will be reduced platelet count is happening. Okay, immune thrombocytopenic purpura, due to the autoimmune activity there is an antibody is generating, and because of the action of the antibody, what happened, they will destroy the platelets. Okay, they will destroy the thrombocyte or platelets. Okay, because of that, what happened, main function of the platelet is to clotting. Okay, blood clotting is done by the platelet. Okay, so whenever there is reduced platelet function, what happened, bleeding will be occurring. So you will can get, there will be bleeding, purpura. Okay, purpura means the blood vessels, small blood vessels are started to bleeding in the skin. Okay, below the skin area you can see the bleeding. So there you can see the red spots are there, no? So that is called as purpura. So this purpura, petechiae, okay, both are indicating small blood vessel leak under the skin. Okay, purpura, petechiae, both are small blood vessel leak under the skin. Okay, so this blood vessel leaking is happening, no? So because of that you will be getting that red spots are there. Okay, so this red spot, if it is between 4 to 10 mm size, then that condition is called as purpura. Okay, the bleeding is happening, you will be getting a skin lesion. You can see there is a red color spot is happening. So that spot, if it is size is between 4 to 10 mm, so that skin lesion is called purpura. Okay, if the spot lesion, that is the size is less than 4 mm, then that lesion is called as petechiae. Okay, 4 to 10 mm size type of lesion you are getting, that is purpura. Less than 4 mm, that is petechiae. Okay, if you are getting more than 1 centimeter size lesion you are getting, that is called as ecchymosis. Okay, so ecchymosis, purpura, petechiae, these three things are indicating bleeding under the skin. Depends upon the size, these three terms are coming. 4 to 10 mm, between that size, that is purpura. Less than 4 mm, petechiae. More than 1 centimeter size bleeding is happening, then that is called as ecchymosis. Okay, so due to the autoimmune action, what happened? There will be destruction of the platelets are happening, and because of that there will be bleeding. So mainly you will be getting purpura, petechiae, so such type of symptoms you can see in the lower limb. Okay, and along with it you will be getting nose bleeding. Okay, if it is a severe decrease of the platelets are there, then you will be getting severe nose bleeding will be there. Okay, so usually there will be two types are there, acute and chronic immune thrombocytopenic purpura is there. Acute means it is usually happening in the children. Okay, 2 to 6 year age group people, they used to get it. So first of all they will be getting an infection, then after that they will be getting this ITP. Okay, so onset of bleeding will be before abrupt. Before abrupt means it was sudden. Okay, suddenly you will be getting bleeding in the case of acute ITP. In chronic ITP it is insidious. So insidious means inside you will be getting the bleeding. So suddenly you can't see, after some time you can see there is a purpura, petechiae, so such type of things are happening. Okay, hemorrhagic bullae you can see in the mouth in case of acute ITP. In chronic you can't see. Okay, platelet count will be less than 20,000. If it is chronic, 3,000 to 80,000. Okay, eosinophil and lymphocytosis you can see in the case of acute ITP. In chronic ITP it is very rare, and spontaneous remission like that it can occur in case of acute. Okay, 80% of the cases usually it will be reoccurring. Okay, and in chronic cases it will not reoccur, it will take little bit time to reoccurring. Okay, so what happened, there will be, because of the this excessively this platelets are removing from the body, so what happened, there will be normal or increased quantity of megakaryocytes will be happening inside the bone marrow, because bone marrow is the place where these blood cells are forming. So megakaryocyte is a cell, it is a large cell, they are producing the platelets or thrombocyte. Okay, megakaryocytes, they are producing the platelets and thrombocyte. Because of this autoimmune action, excessively platelets are removing from the blood, and because of that what happened, there will be deficiency of platelets. So this will be knowing by the bone marrow, so they will be producing the megakaryocytes excessively, and through that way if you examine the bone marrow you can see increased megakaryocytes you can see. Okay, so you will be getting in the bone marrow increased megakaryocytes. Why? Because the platelet deficiency is happening in the blood. So that will be getting that impulse to the bone marrow, and because of to maintain the platelets, so bone marrow will be producing the megakaryocytes. Because megakaryocytes they are converting into, they are producing the blood platelets and thrombocytes. So that's why megakaryocytes will be excessively producing in the bone marrow. So increased megakaryocytes you can see in the case of ITP. Okay, and because of the autoimmune action there will be decreased platelet will be happening, that is also you can see. Then this disease will be resolved in 80% of the patients in 2 to 6 weeks. Okay, most of the cases this will be self remission. Okay, this ITP, acute ITP, within 80% of people it will go on its own. Okay, if it is severe platelet is not severe platelet deficiency is there, in that case you can do platelet transfusion or corticosteroid therapy for controlling the inflammation, or otherwise if there is no response from the steroid tablets then you have to go for the splenectomy. So these are the treatment protocol for the ITP. Okay, most of the cases it will go on its own. If it is severe deficiency is there, then platelet transfusion, then you can give for controlling the inflammation corticosteroid. If with the corticosteroid it is not getting controlling properly, then you can go for the splenectomy. So these are the treatment protocol for the ITP. So here the bleeding into the joints, it is not a correct option. Okay, it is usually happening bleeding into the skin. Okay, so after the one infectious condition, suddenly there is an autoimmune reaction is happening, and because of that what happened, platelet deficiency is happening, through that way bleeding is happening under the skin. Okay, that is called as immune thrombocytopenic purpura. So here the question was, patient will be suffering with the ecchymosis petechiae. Both are bleeding which is happening under the skin, and there will be no hepatosplenomegaly. So that is a condition called immune thrombocytopenic purpura. So among these other three options are related to the ITP. So bleeding into the joints, it is not a correct option. So the answer is bleeding into the joints. Next question is, 60-year-old woman, easy bruising, petechiae, fatigue, pancytopenia, abnormal immature cells are present in the blood circulation. Okay, so what is the condition they have asked? So it is acute myeloid leukemia. So acute myeloid leukemia, it is usually happening in the old age woman. Like old age people, they used to suffer with the acute myeloid leukemia. So acute myeloid leukemia means it is a cancer of the myeloid cell. Okay, it is a cancer which is happening in the myeloid cells of the bone marrow. Okay, so you can see this is the bone, inside bone marrow is there. So the bone marrow inside stem cells are there. So the stem cells are two types are there, myeloid stem cell and lymphoid stem cell. Myeloid stem cell, they are progressing to form myeloblast cell, and these myeloblast cell they are forming RBC, WBC and platelets. Okay, so another one type of cell is present in the bone marrow, that is lymphoid stem cell. So that is will be turned into lymphoblast cell, then that will be turning into white blood cells, which means lymphocyte. Okay, mainly lymphocyte they will be producing. So you can see there is a myeloid stem cell disorder is happening. So what happened? There will be no, because of the dysfunction, this myeloid stem cell is getting cancer. So because of that what happened? Myeloblast cell will not be functioning properly. So what happened? There will be deficiency of RBC, WBC, platelets will be there. Okay, because of the cancer of the myeloid stem cell, proper myeloblast cell will not be forming, and if the proper myeloblast cell is not there, then proper RBC, WBC, platelets will not be there. So it results in the pancytopenia. Okay, pancytopenia means there will be deficiency of RBC, WBC, platelets. Okay, so that condition is called as pancytopenia. So it is usually this myeloid stem cell cancer is happening in the old age people. So they will be suffering with the pancytopenia. So if there is RBC cell is decreased, then what happen? The patient will be suffering with the anemia. If WBC cell is reduced, then what happen? The patient will be suffering with the recurrent infection. If platelet is decreased, then what happen? The patient will be suffering with the bleeding. Okay, so that you can see there will be easy bruising, so there will be bleeding is happening. Okay, that will be their petecia, that is also bleeding, fatigue because of the anemia. Then pancytopenia, if you do the blood checkup, there will be decrease of RBC, WBC, platelets will be there, and presence of the abnormal immature cells. So that's are all indicating into acute myeloid leukemia. Okay, so there is a cancer is happening in the myeloid cell. So because of there will be rapid growth of abnormal cell is happening in the bone marrow and the blood, and it will interfere with the normal blood cell production. Okay, because of the cancer in the myeloid, so the proper RBC, WBC platelets are not forming. So the patient will be suffering with the fever. Okay, because WBC is very less, so it result in the recurrent infection. So fever will be there, bone pain will be there because excessively abnormal cells are producing inside the bone marrow, so it result in the bone pain. Lethargy, fatigue, shortness of breath, pale skin, these are all indicating anemia. Frequent infection, that is due to the less WBC, easy bruising, unusual bleeding such as frequent nosebleed, bleeding from the gums. So this type of things you can see because of the less platelets. So this is called as acute myeloid leukemia. Okay, so acute leukemia, so two types are there, acute myeloid leukemia and acute lymphoblastic leukemia. Okay, acute lymphoblastic leukemia means, which means it is affecting the lymphoblast cells. Okay, so that is usually seen in the children. Acute lymphoblastic leukemia, it is commonly seen in the children. Acute myeloid leukemia you can see commonly in the old age people. Okay, so these condition is interfering the development of the blood cell production. So it is a 60-year age group lady, she has come. So the condition is acute myeloid leukemia. Okay, so symptoms of the acute myeloid leukemia: weight loss, hepatomegaly, splenomegaly, weakness, fatigue, enlarged lymph node, excessive sweating, bone pain or joint pain will be there, loss of appetite, abdominal discomfort or pain, pale skin, shortness of breath. So these are the symptoms of the acute myeloid leukemia. Next, we'll discuss some of the picture questions. They have asked asked to diagnose some of the pictures. So the first picture is, this is indicating geographic tongue. Okay, so geographic tongue means it is a non-cancerous condition. So that is producing a smooth reddish skin on your tongue. Okay, like a map. Okay, so such type of one patches you can see in the tongue area, that is called as geographic tongue. Okay, it's called geographic tongue because the patch pattern resemble how land masses and oceans are shown on the map. If you take a map, you can see how the land is marking, the ocean is marked. In that way, you will be getting a lesions in the skin, lesions in the tongue, that is called geographic tongue. So here the symptoms are, you will be getting pain, and you will be sensitive to some of the food items such as spices, salt and sweet. Whenever that type of food you are taking, so that time you will be getting severe pain or burning sensation, so that type of symptoms will be there. So the risk factors, those who are suffering with the psoriasis, eczema, type 1 diabetes mellitus, and who is suffering with the reactive arthritis, and vitamin deficiency like zinc deficiency, iron deficiency, folic acid deficiency, vitamin B6 and vitamin B12. So those who are suffering with this vitamin deficiency, they can get geographic tongue. Okay, so these are the risk factor. Those who are suffering with these disorders, they can get geographic tongue. And the treatment is mouthwash, analgesic and NSAID. So these are the treatment you can give for the geographic tongue. Okay, you can see the lesion is clearly, you can see there is some mark you can see. Okay, so like a map, you can see the some drawings are there, that is called as geographic tongue. Next picture they have shown is, this one is vitiligo. You can see the white patches are there. Okay, so vitiligo means the skin color is losing. Okay, loss of pigmentation, that is called as vitiligo. Okay, usually you can see it in the hand, forearm, feet and face area. These are the locations where you can get the vitiligo. So vitiligo, it is a autoimmune condition. Okay, vitiligo, it is an autoimmune condition. So what they are destroying here, they are destroying the melanocyte. Okay, they are destroying the melanocyte. Because of that, what happened, melanin production will not be happening, and the melanin is the main thing which is giving pigmentation to the skin. Because of the melanin production is not happening, so there will be loss of pigmentation. Okay, so that is called as vitiligo. So it is an autoimmune condition, and those who are suffering with any other autoimmune condition, they used to get vitiligo. Okay, which means those who are suffering with the Addison's disease. It is a autoimmune condition, which means it is a destruction of the adrenal gland. Okay, Addison's disease is autoimmune condition. Because of the autoimmune condition, they are destroying the adrenal gland, that is called as Addison's disease. Then anemia. Okay, then type 1 diabetes mellitus, systemic lupus erythematosus, psoriasis, rheumatoid arthritis, thyroid disease, which means Graves' disease, Hashimoto's thyroiditis. So this type of autoimmune condition, those who are suffering with this type of autoimmune condition, they used to get vitiligo. Okay, or otherwise as a vitiligo as such, as a single condition you can get it. So it is usually associated with the autoimmune condition. Those who are suffering with any other autoimmune condition, they can get vitiligo. Okay, it is a loss of skin pigmentation. Here there is a destruction of the melanocyte, and because of that, melanin production is not happening. So because of that, you will be getting vitiligo. Okay, so mainly you can see in the hand, feet, arms and face, mucous membrane inside the mouth, lips and nose area. There also you can get, in the genitals you can get. And for diagnosing this vitiligo, Wood's lamp you have to use it. Okay, Wood's lamp investigation you have to do it. Through that you can identify it is a vitiligo. Okay, and the treatments for vitiligo, medications you can give, like for controlling the inflammation, light therapy, depigmentation therapy, surgery and counseling. Okay, why counseling is because this vitiligo white patches will be getting, no, so they will be getting some, they have some, like some other people, they will make some reduced self-esteem will be there. Okay, so because of that we are giving counseling. So these are the treatments for the vitiligo. Okay, so this is the vitiligo picture. Okay, so this is this condition is vitiligo. It is an autoimmune condition. Okay, so these are the details regarding vitiligo. Next, another picture they have shown, this is shingles. Okay, shingles mean herpes zoster. It is a reactivation of the varicella zoster virus. Okay, shingles means herpes zoster. It is a viral infection. It is a reactivation of the varicella zoster virus. Varicella zoster virus, usually they are producing chicken pox. Okay, so those who are suffering with the chicken pox, okay, what happened after the chicken pox, the virus will not leave from the body. Okay, instead the virus stays in a portion in your spinal nerve root called dorsal root ganglion. There they will be going and hiding. Okay, whenever the patient is suffering with a weak immune system, so that time what happened, this reactivation of the virus will be happening. That condition is called as shingles. Okay, so which area, in which part of the spinal nerve root they are, which part of the spinal nerve root they are hiding, in that portion you will be getting the painful blister formation you can see. Okay, painful rash or blisters you will be getting on the skin, that is called as shingles. Okay, it is caused by the varicella zoster virus, which is causing chickenpox. Okay, so what are the risk factors? HIV patients, cancer, organ transplant recipient, this type of people will be suffering with the less immune as a part of that. So that time reactivation of the varicella zoster virus, so that time you will be getting painful rashes on the skin, that is called as shingles. Okay, so symptoms are itching sensation will be there, tingling sensation, burning sensation in the skin, redness will be there, raised rashes will be getting, fluid filled blisters, mild to severe pain in the area of the skin is affected. So these are the symptoms of the shingles. Next picture you can see, this is plantar warts. Okay, you can see the plantar warts, or otherwise known as verruca plantaris. Okay, it is a rough bump is forming in the sole of your feet, that is called plantar warts. Okay, this is happening because of the human papilloma virus infection. Whenever you have get a cut or a trauma is happening in the feet area, so through that way HPV virus will enter into the body and then they will be creating these warts. Okay, so symptoms are there will be similar to appearance of the other warts. Okay, but they exist deeper in your skin like an iceberg. Okay, these warts are existing very deeply and rough thick surface will be there. It will be look like a cauliflower. Okay, so such type of patches you can see. Discoloration will be there, dotted with a brown or black specks will be there. Okay, so you can see the dry type of small holes you can see, no? So that is called as wart seeds. Okay, so these are actually dried blood clots. So this you can see, and pain or tenderness will be there, discomfort will be there, bleeding will be there. So these are the symptoms of the plantar warts. Okay, so which are the areas you will be getting? Especially you will be getting in the on, around or between the toe area or on the balls of the feet area on your heels. So these are the locations of the plantar warts. Okay, so to prevent this plantar warts, you have to wear shoes, sandals. Okay, and then wherever you have to use it in the locker rooms, swimming pool, shower. So in these all areas you have to use the shoes or sandal and keep your feet clean and dry. Okay, avoid contact with the warts on other people. Okay, then avoid using pumic stone. Okay, or emery board that has been in contact with a wart. Okay, you have to maintain the hygiene. Wear clean dry socks when wearing shoes. Avoid going barefoot in communal areas. Okay, so whenever there is a trauma is there in the feet, through that way HPV will enter into the body, then they will be creating this wart. So that's why you have to maintain hygiene always. Next, another picture they have given, this is chilblains. Okay, chilblains or otherwise known as pernio. Okay, it is a inflamed skin. You can see this in the fingers. Okay, in the toe area you can see the inflammation. Okay, so that is developing after it is exposing to the cold air. Okay, cold air, whenever the toes are exposing to the cold air, so that time you are getting this inflammation that is called chilblains. Okay, so it is usually happening in the fingers or in the toe area, but it can develop in the leg also and in the ear also. Okay, so it will be typically red or bluish in color. Itching sensation will be there, tenderness or painful will be there. Another names of chilblain is pernio and perniosis. Okay, and within 1 or 2-3 weeks it will go. Okay, it will resolve on its own because it is due to the cold air it is happening. So if you make it little warm, so through that way you can reduce this chilblain. Okay, because of the cold air, the blood vessels near to the skin surface area will become decreased oxygenation, and through that way inflammation will be happening. So that's why you are getting this red or bluish discoloration. Okay, so other symptoms will be blister formation, burning sensation, itching, and the skin color will be changing into red or blue patches. So these are the symptoms of the chilblains, and the management is always you have to keep the hand and feet in a warmers. Okay, and wear layered clothing or blanket, and wearing a hat is also important. Okay, hat covers your ear to keep your whole body warm and help prevent loss of feet from unprotected areas of your body. So that's why you have to make hand and feet warm. At the same time you have to wear the hat. Through that way ear will be warm, and through that way your whole body will become warm. And moisturize the skin area. Okay, so these are the management you can do for the chilblain. So these are the picture questions they have asked for the exam. Okay, so next some of the other questions we can see in the next video.